you help disseminate that? Like,
Yes, I'm so glad you brought this up because I do feel like this is a huge thing, right? It's really our health system is set up that like we often try to treat ourselves, right? And there's so much on social media, and I'm like, oh, I'll just follow this pelvic PT and do what she tells me to do on her Insta. Things will be fine. And usually most of that is strengthening, right? And so I think it's so hard because my default is like the benefit of exercise usually outweighs any kind of negative side effects, right? We just want people to move and be active. But you can do too much strengthening in the pelvic floor, right? If the pelvic floor is tight, which is super common when we have a lot of tension here, it's super common if we've had some chronic pain anywhere in the body, right? We hold tension in the pelvic floor just like we hold tension potentially like in the jaw. Postpartum is another big one, right? There's a lot of trauma that happens to those tissues. And so our bodies, like I said, are good at compensating. And so that compensation sometimes is like, we need stability, we're going to tighten up.
mm,
And then that chronic tension's there, and all you're doing is trying to strengthen, and you're just making that tension worse. So I do really feel like that's where seeing someone, right? And maybe it's only one or two visits, right? A lot of patients are like, oh, I can't afford it, or it's too hard to get there. But just having at least a pelvic floor health assessment and see like, are things tight? Are they weak? Is it both? Both is a common thing.
yeah, the both
Um,
thing that's complex.
yeah, and it really, I mean, it seems counterintuitive, right? Like it should be one or the other, but I think, and it's sometimes it's not even like true weakness. What I see a lot of is people who hold a lot of tension there, those muscles are just fatigued. So like if you're holding extra tension, think about like your biceps, right? If I walk around all day and like hold something, I probably have some good strength, but when I need them to work, like those muscles are fatigued. The pelvic floor now hard, and it's like, whew, I'm giving up. I've held long, I can't do it. It is big tension piece. And if we can get those pelvic floor muscles to relax, like when you're sitting at rest, those pelvic floor muscles should be chilling out. Like you shouldn't feel like you have to hold tension there all the time. But a lot of us do that without really even realizing it.